Last week, Governor Wolf put out his plan for reopening, which included criteria for a region or county in the state to progress toward reopening. While the plan made clear it wasn't the only metric that would be looked at, the most prominent was a target of 50 or fewer new cases total over a 14-day period for every 100,000 person population. For Delaware County, this would translate to roughly an average of 20 new cases per day over 14 days. By comparison, this past week we saw an average of 139 new cases per day versus this target of 20. And since the threat in one county easily crosses to neighboring counties, a similar population adjusted target would also have to be reached in our neighboring counties for a partial lifting of the shutdown to occur in our region. Even with the real efforts we've been making at our current level of new cases per day and similar levels in our neighboring counties, the truth is we are not yet close to the governor's target for reopening in southeastern Pennsylvania. Council views our current situation as two separate challenges that require separate approaches: infections in our nursing homes and other congregate care facilities, and the outbreak in the broader community at large. Roughly 70% of the deaths from COVID-19 in Delaware County and 20% of positive tests have occurred among our nursing home populations. The tragic situation in many of our nursing homes is not unique to our county, as nursing homes throughout the region and country have also been hit hard due to the particular vulnerabilities of this population. With the support of our partners in the Chester County Health Department, Delaware County is working with nursing home management to get them the resources needed, as well as the guidance to mitigate the dangers as best we can. We will continue to take every available measure to keep our seniors in congregate care facilities as safe as possible while they deal with this unprecedented danger. Our partners in the Chester County Health Department have a physician-led team of trained staff members working daily with nursing homes and other congregate care facilities to ensure patient and staff have the information and resources needed to address their facility's unique issues in their COVID-19 response. Any progress made in the broader community will not distract us from the ongoing heightened risks for our vulnerable nursing home residents. Protecting our seniors and the most vulnerable will remain a top priority, as it has been. The second distinct issue is the level of spread in the broader community. While COVID-19 is still circulating in the community at a rate that is unsafe to allow for a full reopening of most businesses, there has been progress. With the necessary resources, and if the public continues to adhere to proper safety measures, we can begin at least a partial reopening before too long. That is why we have asked that the governor measure progress using metrics that separate out new cases in nursing homes from new cases in the rest of the community. Looking at the two populations separately will help us take appropriate measures in both our nursing homes and in the broader community without confusing our understanding of the situation in either.
Thank you, Secretary. Our first questions are similar from ABC 6 and WHYY. Delaware County officials in suburban Philadelphia are asking that your office separate their positive cases in nursing home facilities from the general population in the county cases. The idea is that there are far more nursing home cases since you are basing reopenings on the number of COVID cases, and it should reflect the general population, not the bulk of cases in nursing homes. Is this something that you would do? Is it something you're considering? And do you think it's safe to do, given that the staff leave the facility to shop?
No, we haven't asked this question before, and we're not going to separate nursing home cases from other cases in counties. What we have certainly learned in this global pandemic of COVID-19 is that we are all interconnected. One section of our community, such as a nursing home or personal care home, impacts the general community, and the community impacts that facility. The staff go back and forth. And so it really is an example of how we are all connected, and it's very important to include those type of facilities among other congregate settings in the total counts for a county.
seen, so the question is, or the comment is, that some of our neighboring counties have, I guess, asked the governor to not count individuals in long-term care facilities as part of their county counts. I've heard some conversation about it. I haven't seen anything in writing, so it's hard for me to comment on exactly what they said because I haven't seen it. But I will say this, that first of all, these are our grandparents, our parents, our brothers and sisters. These are human beings that are in long-term care facilities. And they are there for lots of different reasons. Some are there because they require a lot of daily care and maybe too much care for a family member to do on their own. Some of them don't have a lot of family members. Others are there for shorter stays, perhaps recovering from a stroke or a hip replacement or something like that. So these are members of our community, and they should be treated with respect and care as we would any of our parents or grandparents. I also want to remind people that when these individuals go to the hospital, and not all do, some do have what are called do not hospitalize orders, and that is at their request or their family's request. But if an individual does go to the hospital, they usually go there by an ambulance, so they call 911, and that brings a paramedic team to safely transport them to the hospital. And then, of course, once in the hospital, they are obviously occupying a bed in the hospital and using those hospital resources. So, in my mind, they absolutely count, both as human beings, most importantly, but also as individuals that could make use of our healthcare system. I do think that as we continue to look at our numbers, it is reasonable to do as we are doing, which is to begin to separate them out, which is actually not as easy as it would seem on the surface, because the results don't come in separated out by long-term care facility. So what my staff has been working on for the last week or so is making sure we have all the addresses correct, and then sorting our results every day by the many addresses of these congregate care facilities, and then literally counting them. Like, that's what it takes. There's no easy way to separate them out, but we're doing it, and we're starting today, as I announced, and looking at them separately, because I do think it's possible, I don't have the data to prove this yet, but I do think it's possible that we may see differing rates of both infection and decline when comparing individuals in the community to individuals who live in a congregate setting like a long-term care facility. And that it may be quite appropriate to look at those rates separately and perhaps assess those rates differently.
So separating them, not discounting them, basically.
We're going to separate them. I said, I've been talking about doing that for a week. We will never discount these people.